Listen, the best medication for your patient is the medication that they're going to take. I feel like a lot of times in psychiatry, there is this focus on what the patient should be doing or the medication that they should be taking, rather than the medication that the patient wants to take or if they want to take medication at all. And whether or not people with mental illness should be forced to take medications is an entirely different video, and I don't really want to get into that here because we're talking about something else. But let's say, for example, we have a patient with a thought disorder that comes in and they do a trial on clozaril, and they do really, really well, and they have great symptom management. So maybe they're not responding to a lot of internal stimuli and whatever. So the provider wants them to be on this medication because they've seen drastic improvement. However, the patient does not want to do the blood work that accompanies the clozaril. And I've seen in practice that this kind of gets thrown to the wayside. It's just kind of like, well, we'll see if the patient shows up for their blood work and go from there. We're setting the patient up for failure when they tell you they don't want to do something, or if they refuse the lab work in the hospital, they're certainly not going to come get it outpatient. If we were talking about a medical illness, it's likely this is the point where we would discuss alternatives with the patient. But when it comes to mental illnesses, we really think that the best possible outcome for our patients is the complete elimination of symptoms, or at least getting rid of the symptoms as much as we possibly can, especially symptoms that make us uncomfortable, like a patient responding to internal stimuli because they're having hallucinations. And psychiatric medications especially are notorious for having really bad side effects. And if a patient would rather have more symptoms of their illness on a different medication, that's perfectly acceptable.